Hi, I'm Dr. J. Varma, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world, and I give you expert insights on infectious diseases and public health. This is the weekly episode of Inside Outbreaks. And on these episodes, I review the latest outbreaks of infectious diseases, the outbreaks that you need to know about. And I do this with my friend and colleague, Jon Epstein, a veterinarian, virologist, and disease ecologist who, like me, has spent his career tracking dangerous infectious diseases across all corners of the earth. Thanks, Jon, for joining me today.
Thanks for having me, Jay. It's great to see you.
Yeah, great to see you as always. And last week we tried a new thing. We sort of jumped right into what we were calling our infectious disease rounds,
Yeah.
where we covered a few of the sort of hot, big outbreaks that we're watching. So what do you think about doing that again?
Yeah, no, I think it's a good idea, Jay. I like it because it lets us cover a little bit more ground, even if just briefly, because there's so much going on around the world in the US and Europe. It's worth talking about. It's a good
Yeah.
idea.
Absolutely. And I'm the one that sort of scans the headlines and usually sends them to you, and you send me some back and things. And so just for people to understand is these aren't necessarily the events that are most likely to make you sick today, but they're kind of a combination of things that are emerging where they're raising kind of important public health issues. Some of them may be acute threats to your health, but some of them are also just sort of interesting insights into the world of, that we live, the world we share with animals and the environment. And also the way we as humans do or do not, do the things necessary to control them.
Yeah, it's a good point. It's really interesting. There'll be some recurring themes we talk about. There already are how climate change and environmental change influences how we come into contact with animals, and that can lead to disease outbreaks. And so, getting to talk about the overall drivers and trends that impact our health is really it's interesting.
Yeah. And it's one of the reasons I love doing this with you is because I think one of the things I always loved about public health was that it was multidisciplinary, right? I want to work with
Absolutely,
people
me
who know
too.
things that I don't know and who have, a different set of knowledge, and they can approach a problem with just a different lens. And so that's why it's great to have somebody who's so connected, obviously, to animal health and environmental health, to sort of complement my knowledge and experience
Yeah.
with human health.
I couldn't agree more. We're a great team and really enjoy this too.
All right. With all that self-congratulations over, I'm going to get to an issue that is back in the news and I say
Ah,
it's back in the news because somebody literally just texted it to me at like, I don't know, 9:30 last night and said,
mhm.
"Hey, what is up with this new COVID Stratus variant?"
Wait, COVID's
And
still around?
believe it or not, it's not a hoax somehow, or it's an ongoing hoax forever. Okay,
Fair.
so what is the COVID Stratus variant? So the variant is also known as XFG, and it's the latest COVID virus mutation that appears to be getting media attention. And I mentioned media attention very intentionally. So COVID really hasn't gone away, right? COVID has been with us effectively since the end of 2019 and continues to mutate. And these new mutations or variants cause different types of disease at different seasons and migrate through time, right? As time goes on, the virus has a tendency to mutate. So what is going on with the Stratus COVID variant? What we know is that it was first detected in Southeast Asia earlier this year. And by June, it had spread to over 40 countries, was designated by the WHO as a variant under monitoring. And in the US, both the Stratus variant and another one known as Nimbus are increasingly being detected. So, Jon, before we get into this in more detail, just give a little brief primer on what COVID variants are and why we care about them and how we look for them.
Absolutely. And the first thing to say is this is what we expected to happen. When we see the emergence of a new disease, one especially that comes from animals and establish itself in people, over time as it circulates, it will mutate and evolve. And that is in response to our immune system, to different environments that the virus encounters. And so what we look for when we look for variants or changes in the genetics, the amino acids, the proteins that influence how the virus either spreads or the type of disease it causes. And that is what WHO and CDC and the European health agencies are tracking through genetic information that comes in from different cases.
Yeah. And so one of the things that's happening is, and this is where I get a little bit sort of frustrated with the media coverage about this. Essentially, COVID continues to mutate, just like every other virus continues to mutate.
Right.
And from a personal health perspective, we're seeing stories right now in the news that say, oh, this new Stratus variant is causing a persistent dry cough, or the Nimbus variant is causing a razor blade sore throat. Let's be very clear. Pretty much ever since COVID emerged, the virus has caused the same types of upper respiratory symptoms that it has caused ever since the beginning, regardless of how these variants have evolved. We have not really seen any change in the presentation of illness. Different people, for reasons we don't fully understand, may get more of a sore throat, or may get more of a cough, or may get more nasal symptoms. But functionally speaking, you don't need to be tracking every single type of variant. During the time I was the leading the COVID response for the city of New York, I put a tweet out and said, we need to stop with pathogen porn. Like, stop trying to make inflammatory reports about viruses. What we do care about is whether or not it has shifted dramatically in some way and how much it transmits. And that is what happened with Omicron. And that's why Omicron was such a big deal. It wasn't causing a different type of illness. What it was causing was more rapid spread through the community. So the message to people out there is really just go ahead, get your COVID boosters, continue to boost your immunity. Don't worry about the latest variant right now, because they're all going to cause a similar illness. And some of them are going to cause long COVID, and some of them are going to cause all sorts of other things like increased clotting and heart attacks and things that you don't want.
Yeah, no, look, it's important, and some of it gets overly technical, but for these two in particular, these Nimbus and Stratus, the Stratus has a little bit more immune evasion. So what they're looking for is, will the vaccine still protect you? And the answer is yes. The vaccines are still going to be effective for both of these variants, both Nimbus and Stratus. So continue to get them. It's going to reduce severity of disease and could potentially keep you out of the hospital. And then for Nimbus, it's slightly more transmissible. What that means is that this variant is slightly better able to attach to the receptors that get it into your cells and cause it to replicate. And that's the kind of thing that causes one variant to dominate over another, is if it's more transmissible, it spreads more quickly and crowds out the others. But you're right, Jay. What the public really needs to understand is, can this still make you sick? Yes. And will the vaccine still protect you? Yes. But there's nothing dramatically different about these variants, as you pointed out. And so, it's worth paying attention to at the public health level. But for the public, the message is still get vaccinated and still recognize that they're out there and circulating. And this is a human respiratory virus.
Yep, absolutely. It's still with us. And what I'm doing in my clinic right now is trying to get every one of my patients to get the annual influenza vaccine and to get their COVID vaccine as well too. So let's go on to round item number 2. This is a pink eye outbreak at a military base. Okay. Pink eye is the sort of common colloquial term for what we in medicine call conjunctivitis, or inflammation in and around your eye. Okay. And there was an outbreak of an unusual outbreak that occurred on a military base, Joint Base San Antonio, Lackland in Texas. And this outbreak occurred from February to May of 2025. In total, there were 47 laboratory cases reported among close to 12,000 military trainees. And basically what's interesting about it is the pink eye was not caused by a virus, which is what causes almost all of the conjunctivitis cases that, we tend to see in clinic, or that your kids might get when they're in childcare or daycare. This was actually caused by an unusual strain of the Neisseria meningitidis bacteria. And Neisseria meningitidis is also known as meningococcus, or the bacteria that causes bacterial meningitis.
Yeah, and I assume it was treatable with antibiotics.
Yeah, well, so the interesting thing about this is that this infection, they did a tremendous amount of sort of laboratory testing to try to figure out what was going on. And what they found, it was that it was sort of an unusual strain of meningococcus in that it no longer has like a bacterial capsule around it. And it did, in fact, have decreased antibiotic sensitivity. But what they found that's really important to think about is they decided that patients did actually not necessarily need medical treatment for it. They could respond to, antibiotics if the infection got worse. So they were treated with antibiotics topically, not orally, such as moxifloxacin, ciprofloxacin, erythromycin. But also, interestingly enough, the vaccine, getting the meningococcal vaccine, didn't protect them. So the basic message is bacteria keep evolving. You can have unusual outbreaks of common bacterial infections that, just like we talked about with COVID and viruses, can mutate and present in kind of unusual ways.
Yeah. And of course, if this is anything like, viral conjunctivitis, it spreads pretty easily. And when you have a military base where it's kind of like a college dorm or any kind of situation with lots of people living in close quarters, I would imagine this spread pretty easily amongst the troops.
Yeah, outbreaks in military barracks are kind of a classic thing. Like when you first train at CDC, you kind of learn about like outbreaks at like a church lunch session,
Right, your classic
like a common
foodborne.
community foodborne
Yeah.
outbreak. And you also learn about outbreaks in military barracks. And these are places where a lot of people are coming together and having some shared experience, and that, whether it's the food they eat or the linens or the towels or the surfaces that they're sharing, something goes off, and that's what causes the infections.
Yeah.
So the
All
next
right.
outbreak I wanted to talk about was one, because it's a recall to something that we just talked about fairly recently. So this is an outbreak of HIV infections occurring in Fiji, which, again, we always think about Fiji as a beautiful tropical place, but it turns out it's experiencing one of the fastest growing HIV epidemics in the world, with over 800 new cases confirmed in the first 5 months of 2025, and projections that there may be more than 3,000 cases by the end of the year. And the reason I wanted to bring this up is because we just had a recording that you and I did discussing an HIV outbreak occurring in Maine. And the common feature between that outbreak in Maine and this outbreak 10,000 plus miles away in Fiji is injection drug use. Okay. And it's people who are, sharing needles, most likely unhoused. So they're not having a chance to even clean those needles as well. And this can lead to really explosive outbreaks of a deadly and basically uncurable disease.
Yeah, I got to tell you, Jay, there was something else that came up in the news just yesterday that was really disturbing. There's also been a trend, and this is something that's becoming prevalent in some of the slums and sort of poverty-stricken areas in South Africa and elsewhere, something called Bluetoothing. Have you heard of this? It's disturbing. It's taking blood from somebody who is intoxicated and injecting it into yourself to get high. And so it is not only like it's kind of like intravenous drug use, but it's almost worse because instead of just needle sharing, you're literally injecting blood, and it is driving HIV transmission, as you would expect.
Yeah, I think that the reality is that, as when people are desperate for, well, their lives are suffering in some way, they end up addicted to narcotics. Ultimately, a lot of times people start, in the United States, they start with oral medications and they eventually shift to injections because they really need to chase that high. It's amazing how desperate, people will get. And it's one of the reasons, we talked about before, that you have to approach these problems with empathy. You can be as strong and as strident in your belief that, drug use or drug injections are immoral. I can understand somebody having that perspective. I think what's really frustrating is the fact that we need to also approach these as fundamentally public health problems. And if we can't stop people from using drugs, we at least have to stop them from getting infections. And so if people are doing things like you described, it's essentially like almost like being a vampire, right?
Yeah.
Transferring the blood from one person to another, because they're so eager to get high. We need to do something to at least make that whole process safer and hopefully ultimately end it. But the first step to getting them into the system is to get them to do it safer.
Yeah, no, I agree with you 100%. But what's challenging about this is it goes beyond, clean needle programs, because you're actually taking blood from somebody, which means all the infections they have, you're injecting into your body too. So it's hard to envision a safe practice at all of this type of thing. And I think this is something that we have to increase awareness of and educate. I mean, I agree 100% about approaching it with empathy, but this thing, this is a practice that could be really challenging.
Yeah, actually, I mean, I think your point is actually the right one. I was sort of moving off to the side and thinking more about how do we make all injection safer. But you're absolutely right. This is just absolutely horrific proper thing to do. I mean, you can even get transfusion reactions, right? I mean, I'm not sure how much blood they're injecting into each other, but there are a million reasons why
Yeah.
you would not want to take somebody else's blood and blindly withdraw it and inject it into yourself. So
And
yes.
you're taking jobs away from mosquitoes. You don't want to do that.
Exactly. There you go, John. Well, I got to all bring it back to the mosquitoes,
There it is.
right? And the bats too, as well, right? It reminds me of vampires. And
Speaking of bats, I think Ebola is next on the docket, isn't it? Huh? What's
it
going on
is.
in
So next up,
DRC,
we're going to,
Jay?
yeah, let's talk about Ebola quickly. So we've talked about this before. There was an ongoing outbreak of Ebola in the Democratic Republic of the Congo. As of about a week ago, there were a total of 64 cases, including 42 deaths that had been reported in one health zone in the DRC. The bad, distressing news is that the case fatality rate continues to be extremely high. Over 65% of the people being diagnosed have died.
Hmm.
There have also been 3 deaths among healthcare workers, which we've talked about before, has been really one of the more disastrous aspects about Ebola outbreaks. And, CDC appears to have still been functioning, at least before the shutdown, did put out a really nice risk assessment about this outbreak and estimated that there were a few different scenarios, but estimates were that it would be controlled, and that you would unlikely to exceed, anywhere from 100 to 500 cases. So, John, what are your thoughts about the Ebola outbreak ongoing right now?
Well, from what I'm reading, it sounds like there's more and more resources are being moved into the area. They're getting a better handle on it. I hope that the model projections that show a decline in cases and ultimate control, are on the lower end of the spectrum. But it sounds like they're, really active in contact tracing. I know that they have interventions in place. I also know this is happening. The Kasai province is a pretty remote area with not a lot of infrastructure, so it's hard to move in, via ground. The necessary medicines and setups and tents. But at this point, I think a lot of that's getting to be in place. So from what I can tell, I'm optimistic that this will get under control.
Okay. And the last item on our infectious disease rounds for this week is something that I had never heard about before.
Hmm.
Okay. This was a infection with Borna disease virus in Bavaria, Germany. And it turns out there have been 3 cases of this virus this year, and all 3 of them have been fatal. The most recent case was a 57-year-old individual who died of the infection in early October. And, this is a virus that, from what I can tell, is mainly transmitted by small mammals. So,
Mhm.
John, tell me what you can about this virus, which I had never heard about it for. Where does it come from? What do we know about its ability to cause human disease? And are there any ways to prevent or treat it?
Well, probably the reason you haven't heard much about it is pretty rare, but this is a virus that is carried by shrews, as you mentioned. So the primary reservoir, at least in Europe, is the bicolored white-toothed shrew, which is a fairly common shrew. And this virus, when it gets into people, causes severe and often fatal encephalitis. But again, it's not very common. Generally, uh, public health officials anticipate 5 to 7 cases a year at maximum. So here we have 3, but why we're talking about this is there's been a cluster just recently. It's shed in the saliva, urine, feces of the animal. We're not exactly sure how spillovers happened in this case. We don't have details yet about how people might have been exposed, whether it was food contamination or maybe there was an infestation of shrews around the household. These are peridomestic animals. So we need to learn more about how they might have come into contact with excreta from these shrews. But nonetheless, it's very sad when it happens because it's a severe disease. There's no vaccine or treatment for this Bornavirus disease. So unfortunately, it probably requires hospitalization and supportive care. And then, even with that, it requires people to get through the infection.
Yeah, I mean, it gives me just, again, superficially, as a human health epidemiologist, it gives me sort of whiffs of like, hantavirus and
Mhm.
Lassa fever, infections that cause severe illness in humans that are not particularly common, but are largely end up being transmitted through sort of the urine or feces of, small rodents that contaminate the areas where humans are in, and don't have any good treatments available for them.
Yeah, fortunately with this one, there isn't any human to human transmission. So we're a dead end host. And so that's why we don't see bigger outbreaks. Horses are also susceptible to this virus. So from the same exposures as people, if horses get food contaminated or there are shrews shrews around a barn where horses are staying, they can get infected too. And it can be fatal in horses.
Okay, John. Well, good. Well, we'll keep an eye on that and find out. And I guess if you're traveling in Bavaria, stay away from shrews, right?
Stay away from shrews.
Okay. All right. So that ends our wrap up of sort of like infectious disease rounds for this week. So for our focus topic, I wanted to bring us to the topic of sexually transmitted infections in the United States, specifically syphilis in babies, which is reaching alarming levels. So CDC just released its report on sexually transmitted infections in the United States, its annual report. So this is covering 2024. And while this report seemed to indicate that national STD cases, chlamydia, gonorrhea, and syphilis were declining overall, there was actually something really horrifying buried in this report. There were nearly 4,000 babies born with syphilis in 2024. So just to make that clear, babies who were born with this infection. That is up 2% compared to 2023 and up 700% compared to 2014.
So Jay, this would be cases of mothers infected and babies are being exposed transvaginally, or is it blood, kind of bloodborne in utero? Where is the transmission happening?
Yeah, so syphilis is a infection. It's caused by an unusual type of bacteria, we call spirochetes. And it turns out that if a woman is infected during her pregnancy or has untreated syphilis at the time that she gets pregnant, she can pass that bacterial infection onto her baby. And that baby could die in the placenta, essentially be a stillborn baby, or the baby could be born and have very severe fetal malformations and potentially die very early on. And so, John, I know you're a veterinarian. So as far as I know, you don't really work on sexually transmitted infections at all, do you?
Oh, Jay, it's actually not true. There are instances of STIs in the animal world. And in fact, chlamydia is a really bad one and very important for koalas right now. It's a real threat to conservation. The koala populations, and if people don't know, koalas are only found in Australia. They're a marsupial, and there are very limited and genetically bottlenecked populations in Southern Australia and a bit in Eastern Australia. And so these small populations tend to get impacted pretty hard by infectious disease. And they do get a form of chlamydia that causes really bad GI symptoms. It's sexually transmitted. And so as part of, regular routine mating efforts, koalas are passing it on from one to another, and it does cause mortality. So we do see that in the animal world. The other one that is a little maybe more closer to home is that parrots can carry a form of chlamydia that causes a disease called psittacosis. And if you have a parrot and it's shedding chlamydia and you're immune compromised, it could be really bad for your own health too and cause severe respiratory disease.
All right, John. So what do you do about chlamydia and koalas? Do you give them condoms and treat them with Zithromax?
If only it was that easy. It's really hard to treat. It's really hard to control. And it's something that wildlife biologists and conservationists are really grappling with in terms of controlling it. But it circulates pretty widely in populations there.
Okay. All right. Well, the good news, of course, is that we don't have koalas here in the United States outside of, those that are kept in captivity.
Yeah.
But we do have humans that transmit infections. And just to be absolutely clear, we need to make it clear that sexually transmitted infections are really fundamentally no different than respiratory infections, GI infections. Any type of infection you can get from human behavior can potentially make you sick. We talk on this channel all the time about people who go swimming in the water. So first and foremost, we need to make sure there is no stigma associated with it. Sex is a normal, healthy part of human behavior, and people can get infections through sex just like they can get through any other activity that they do. But the reason we care about these infections is some of them can lead to very serious complications. Chlamydia and gonorrhea in particular can lead to infertility in both women and men, as well as invasive infections that can cause all sorts of damage, both to your genital and reproductive tract, but also outside of there. But the reason I am particularly worried about syphilis right now is that it really represents a breakdown in our public health system. When you see 4,000 babies being born with syphilis in the United States, that means that there is something really badly going wrong with how we detect and track these infections.
That's right, Jay. And, we talked a lot in this show about breakdown in monitoring and surveillance systems. And so there's going to be more and more negative outcomes from that as we miss infections that are otherwise treatable and preventable.
Yeah, and the first step in that is, people who are having symptoms getting access to healthcare services, right?
Hmm.
And with health insurance being a constant, a troublesome issue in the United States, it's
Yeah.
a cause of the, why the federal government is shut down right now. Let's go through some of these barriers. So first, the first big barrier and how you end up, and so let's go through the breakdown in the system and how you end up with babies with syphilis is first you have men who get infected and never get diagnosed and treated. And there is no sort of contact tracing of their potential sexual partners. That's breakdown number one. Men
Hmm.
not being diagnosed and treated, and no contact tracing being done of their female partners. Number two, women then getting infected during their pregnancy and not being tested. Right now, the expert guidelines from CDC, from the American College of OBGYN, is that women should be tested up to 3 times during their pregnancy to make sure they don't have syphilis or get syphilis during their pregnancy. So that breakdown is then occurring.
Hmm.
And then finally, of course, these babies are then being born. And I think some of them have a delayed diagnosis if they actually are born alive as well. So we really need, this is just a perfect window into the barriers we face with healthcare access in the United States, with maternal child health issues, and then of course with infectious diseases as well.
Yeah, and I know historically STIs, and the rate of infection are also linked to public health campaigns and outreach campaigns, and so we need to also stay vigilant about communicating to the public the risk of getting STIs, where to go to get tested, how to get treated, and sometimes it's also just not just an access issue, but also an education issue too.
Yeah, there was a huge campaign to eliminate syphilis in the United States in the 1990s, and syphilis rates dropped dramatically. Now, there was some debate about how much that was due to the campaign versus a lot of STI transmission is driven by gay men, bi men who have sex with men, and other people in those sexual networks where there's a lot of there have been a lot of infections historically, and it's hard to essentially eliminate infections once they're already entrenched within a network like that. But of course, because the HIV epidemic was so devastating, that there was a
Hmm.
much people reduced the number of partners they had. They were much more careful about getting tested and treated, and of course, they were using condoms more often. So that contributed probably a lot to the decline in STIs in the 1990s and syphilis. And there was a real hope that it could be eliminated. But then it's rebounded back,
Yeah.
and in addition to, even outside the sort of gay MSM community, there's a lot of transmission in communities, heterosexual communities, straight communities, where there isn't really good access to sexual health service, and these topics aren't talked about. So that's really where both awareness and education is important, but also really making sure that people have access to routine testing, and it's part of routine healthcare as well.
Yeah, well, I hope 2025 will show a reduction in those numbers, particularly in babies born with STIs.
Yeah, unfortunately, I'm quite pessimistic, right? We're seeing this massive cutbacks in at CDC. The entire STD reference lab at CDC was closed as part of the sort of Doge efforts.
Hmm.
A lot of the CDC materials are now being changed so that they are not very sensitive, and they are more stigmatizing and less welcoming to people. And of course, funding is being cut to state and local health departments. So I am pessimistic, but of course, it's important for us to talk about these things, because these are issues that affect all of us in our communities. And if there's anything you can tell about a society, it's how it treats its most vulnerable, right? And
That's right.
so the way we treat mothers and young babies is a real unfortunate reflection on where our priorities are. And so I really do hope that there will be efforts, even if they can't be led at the federal level, maybe at the state level, to improve our ability to detect and control these infections.
No, I think that'll be really important. The other thing I'd like to see more of, and I think we're trending in this direction, are at-home tests, point of care and at-home tests, because I think with what we saw with COVID and now influenzas, we have more ability to, test at home. Number one, going into a clinic to get tested for an STI in and of itself carries some stigma and can be difficult for some people to do. But if they could test at home and determine whether they're infected and then go seek care, that could really help in a lot of cases.
Yeah, you're absolutely right, John. It's actually one of the things I'm really deeply passionate about is the democratizing of diagnostics, and there just simply has not been enough investment in rapid point of care diagnostics for sexually transmitted infections. There is now a syphilis test that can be used. We probably won't get into it because it's a bit complicated, but diagnostics of syphilis are a little bit challenging.
Mm.
But there is a at-home test that is available for syphilis, and I think if you did get the funding for this, this could be something that could be made available to pregnant women. But of course, we also hope that women are getting tested during their pregnancy because they're going to get regular medical visits as
We
well.
hope.
But
That's
I
right.
do hope that just like we've seen with COVID and flu, the democratization of rapid diagnostic tests, I'm really hoping that we'll see a similar evolution for urinary tract infections, for standard GI infections, and then of course for sexually transmitted infections as well.
Well, Jay, that could be something we track on the show. Maybe periodically we'll talk about what tests are becoming available, what's in the pipeline, maybe new vaccines. There's a big push. We don't talk about this enough. We talk about vaccines a lot, but there's a big international push to democratize the development of vaccines for emerging threats, viruses that have been deemed important and up and coming that don't currently have vaccines. Maybe we could also talk about some of these at-home tests that are coming onto the market just to help people become aware of what they can do at home for their own health.
Absolutely. Lots of interesting topics to discuss. Thank you so much for joining me today, John. And for all of you who
Always a
are
pleasure.
listening and watching, we really appreciate your interest in this topic. Please like, share, subscribe, put comments when you can. All of that type of engagement, it helps us. It helps us reach more people, hopefully makes a difference in helping us to improve public health here in the United States and around the world. And we look forward to seeing you next week for another episode of Inside Outbreaks.
All right, Jay, enjoy the weekend. We have a holiday weekend coming up, and we'll catch up next week.
Great. See you next week. Bye.
Bye.